My name is Joel Januszewski, and I'm the Director of Volunteerism and Community Listening with the United Way. And I'm glad that you're with us today. United Way works to advance education, economic mobility, and health of our community, and we do that by mobilizing resources, people, and organizations. And our conversations about our community bring community leaders to the table to discuss key issues in our community related to those focus areas. And with our conversation, our goal is to bring people together to talk about issues that really matter in our community, to share information, knowledge, and wisdom, and to help provide a path forward so we can work together to better the lives of everybody in our community. Today's conversation is about promoting student mental health and well-being. And we're really thrilled that you're joining us today, and we're excited to have our panelists with us too. The conversation is going to start after we do our introductions with a brief presentation. And then it's going to be followed by a 45-minute moderated conversation. And so for the audience joining us today, that you can provide questions in the Q&A feature through the Zoom conference that we have, and we'll do our best to address those questions in our roundtable as we go. And also, please know that we'll be providing a follow-up email with a link to the recording of this conversation, along with links to resources that we mentioned in the conversation, and we'll get that out to you in the next couple of days after our conversation here this morning. Before we begin, we want to acknowledge that the discussion today, because it's about mental health, that it may include accounts of mental health struggles and experiences of trauma and self-harm and other challenging aspects of mental health. And for that reason, please take care of yourself and utilize any available resources if needed. Know that it's okay to take a break and step away from the conversation if you need to do that, and reach out to a friend and connect, or reach out to professionals for support. With that, I would like to invite our panelists to introduce themselves. And we'll start with Kim McDevitt, please.
Hello, everyone. I'm Kim McDevitt. I'm the Executive Director at Mental Health America of Lancaster County. Happy to be here today.
And Kay, can you go next, please?
Hi, everyone. Kay Foley, she, they pronouns. I am the Executive Director of Lancaster LGBTQ+ Coalition. I am grateful to be here today with professionals to help our students right now who need it.
Thanks. And Ryan.
Good morning. My name is Ryan Flannery. I'm a certified school psychologist within the School District of Lancaster in Pennsylvania.
Hi, everyone. I'm Anna Kennedy, Executive Director of the Touchstone Foundation. We focus on youth mental wellness here in Lancaster County. So I'm going to share my screen and launch right in. All right. Welcome. So we're going to talk about student mental health today, and I appreciate everyone joining us this morning. As Joel said, this is a difficult conversation. I'm going to be sharing a lot of data and some context for why this is so important today. So at Touchstone Foundation, we improve youth and mental wellness here in Lancaster County, and we look at birth through age 25. We focus on these three areas. The first is really around workforce investment in the talent pipeline, and we do that through providing scholarships and license support for recent graduates. The second area is around increasing access by removing the financial barriers for therapy and counseling that often prevent families and young people from seeking mental health care. And the third is around raising awareness through advocacy and policy change. So here's some context. These are the reasons why we chose to update our 2023 conduct our 2023 Youth Mental Wellness Needs Assessment. We had done a similar study back in 2014, but in 2022, the Pennsylvania Youth Survey data was released, and this was the first time that we had data that included the COVID pandemic. We also wanted to conduct a youth listening tour to hear from our young people ages 14 to 26, and I'll talk about that in a little bit. But I want to just take a moment and recognize the gravity of the situation. Our community has lost 3 young people to suicide in the past 6 months. And all 3 of these young people identified as trans in the LGBTQ community. We're deeply concerned that our teens are really struggling in schools and in colleges and in universities. So we listened to some of the bullying, harassment, and discrimination that our young people face in schools in particular. So here is some of the PA Youth Survey data that since 1989, Pennsylvania has conducted this PA Youth Survey among students in grades 6th, 8th, 10th, and 12th to learn about their behavior, attitudes, and knowledge concerning alcohol, tobacco, other drugs, and violence. And this is conducted every 2 years by the PA Commission on Crime and Delinquency. So here is our 2021 Lancaster County data reported by students. So these 2 questions are really indicating feelings of depression. On the left, you can see students reported they felt depressed or sad for most days in the past 12 months. And you can see that the trend in county level data from 2017 to 2021, plus the state data in 2021 in dark blue. And this shows an increase in depression among students over time. And then on the right-hand side, you see students reported, quote, "At times, I think I'm no good at all." And we see an increase over time here as well. So here's some preliminary data for 2023. It's not fully available yet, but 14 school districts in Lancaster County have reported their data so far. So again, students report feelings of depression in the past year. The darker green bars are students answering no, and the lighter green bars are students answering yes. What is important here to note is that we're seeing more 6th graders reporting feelings of depression, which is concerning, those younger ages. So shifting a little bit to our Touchstone Foundation Youth Mental Wellness Needs Assessment, which we released in the fall. Here, I'm going to share with you a little bit of the parent and caregiver survey results, which is a quantitative study conducted last winter to compare and repeat many of the same questions we asked back in 2014 in our Children's Behavioral Health Needs Assessment. So we had responses from over 1,000 parents, and they're mainly reporting on their children in grades kindergarten through 12th mostly. So just a summary on some trends that we would noticed in the latest survey. Number 1, mental health care access and quality has improved, but parents perceive their child's overall mental well-being has declined. Number 2, parents report that behavior and conduct problems such as are the largest increases in need. Number 3, generally parents trust their neighbors, which is great, and feel safe in their neighborhoods, but unfortunately that trust did decline since 2014. 4, parents ask their child's healthcare provider first about mental health care, which is great, but they're also searching online, asking family members, and using social media a lot more. And lastly, number 5, bullying needs have increased. And parents are reporting their child being bullied, excluded, lied about, hit, or teased more frequently. These are the most frequent behaviors that parents reported seeing in their kids in 2023. And we asked parents about the frequency of these behaviors. So the first graph at the top asked parents how often their child was distracted easily. And the bottom graph asks parents how often their child worries a lot. Other behaviors parents noticed: having trouble concentrating, not understanding other people's feelings, and not following rules. And here, the top graph asks parents how often their child does not listen to rules, and at the bottom graph, how often their child has trouble concentrating. And as I said earlier, behavior and conduct problems such as oppositional defiant disorder or conduct disorder had the largest increase in all, from 8.2% in 2014 to a combined 37.05% in 2023. So huge increases there. When we asked how often their child felt sad or unhappy in our 2023 survey, 11.34% of parents responded always, which is quite a lot, and 21.64% of parents responded sometimes. Now, we can see a little bit of a disconnect with the data from the 2021 PACE survey, in which 38.5% of students in Lancaster County responded feeling sad or depressed most days in the past 12 months. Questions not worded exactly the same, but you can see a little bit of a comparison there. Okay, here's a little bit of good news. Most of the questions inquiring about accessibility of services and quality of healthcare indicated improvements in these categories between 2014 and 2023. Most recently, over 95% of parents reported that their children currently had insurance coverage, most commonly through the Children's Health Insurance Program, known as CHIP, followed by medical assistance. However, unfortunately, we conducted this survey before the public health emergency ended the medical assistance coverage that had been extended during the COVID pandemic. So parents and caregivers have reported an increasing need for help in obtaining necessary referrals for their child's mental health care. And this is something we're actively working on here in Lancaster County as a community. We're collaborating a lot, and that's great because this need has increased. So parents also reported that only 42% of children were never purposefully excluded by other children. Again, this is an indicator of bullying. Parents reported that for 10% of children, this happened several times a week. So lots and lots of repeated bullying, discrimination, harassment. We saw a 6 percentage point increase in parents who reported their child was bullied several times a week between the two studies. And then in the PACE data, if we compare what students self-report, 25% of students self-reported experiencing bullying, most commonly emotional abuse, insults, and name calling. But what parents had reported was more of a social isolation. So students, this is really concerning to us, and we want to pay attention to this data because students who have suffered bullying are at an increased risk of hopelessness and suicidal ideation. So unchecked bullying without supports is really a big indicator of depression, hopelessness, and potential suicide. So I want to shift gears a little bit and share with you some data about our youth listening tour. So this was not quantitative, this was a qualitative aspect. And we reached out and requested opportunities with high schools, after school programs, colleges, and universities. And we really just asked these two main questions. It was an open conversation. What barriers prevent you from accessing mental health care in our community? And then what solutions or changes would help you? So we visited 6 different groups. We heard from over 100 young people, and they were really that 14 to 26 age group. So I just want to share with you a sample of what our young people shared, what we heard from them. Here are some quotes from our youth. These are some of the challenges that young people shared with us during our youth listening tour. I'm not going to read them to you, but you can just look them over and see if something stands out for you. And then these are some of the solutions that our young people requested in mental health care. These are some of the changes they want to see. They're really looking for connection and belonging. Here are 2 more notable quotes from our youth. And again, they're looking to connect, and they would love to have clinical care be more accessible to them, more of a mentor type of relationship. So the young people we listen to identify their supports and healthy coping mechanisms in mental health. They know about the importance of good nutrition, sleep, physical activity, breathing, and more. In fact, they were a little bit frustrated that they're often told to just eat better and sleep better. They really want to dig in and have meaningful and deeper conversations. They listed various barriers to accessing therapy, like cost, insurance, transportation, and more. They discussed barriers like not wanting to disclose something about a friend that was shared in confidence and the challenges of breaking trust. They also shared about parents who don't understand or believe their mental health needs, and also parents asking them to just be more tough. And in the quotes, you saw students talk about barriers within the therapeutic environment, wanting to build trust and relationships with their therapist. The overall theme we identified here is that our young people are asking for safe and trusted adult mentors. So this major theme of mentorship that young people identified and requested builds on what we know in the neuroscience research from trauma-informed care, that the presence of a safe and trusted adult in a child's life can actually buffer and repair the adversity that children experience. It can build their resiliency. So our students want this person to be their clinical therapist, but we know that that is outside the scope of therapy, traditional therapy or counseling. So instead, we believe that increasing youth mentorship opportunities for young people can actually provide a much needed opportunity for youth. This is what they're asking for. These young people are often lonely, isolated, facing adversity, facing that bullying, and more. So this opportunity for youth mentorship really goes upstream in preventing the need for clinical mental health care. It could, or it could go alongside to help our young people feel safer and more secure. I think that's all I have. So I'll end there and we'll open it up to some panel discussion.
Anna, thank you for your presentation and the wealth of quantitative and qualitative data from your studies. They're a really important community resource, and they'll be a good springboard for our conversation. The first question I'd like to start with is for Kim, and can you tell us some of the main misconceptions about youth and student mental health?
Yeah, I think the biggest misconception I hear is that we really don't have a mental health crisis, that the only reason we're seeing a rise in depression and anxiety is because there's more awareness about behind it, and people are more comfortable reaching out for support. Our youth are more comfortable saying it's okay not to be okay. But what we're looking at is the data for intensive outpatient services and acuity rates. So the severity of the mental health crises. And we have seen a significant rise in those areas. So that tells us, no, this is more than just going to a therapist. This is needing higher levels of intervention and treatment. So that's the biggest misconception I hear, and I hear it often, quite often. And so, yeah, we are seeing higher rates in depression and anxiety in our youth. But that's only one piece of it, right? So we're also looking at other diagnoses and other mental health issues, and seeing, steep rises in those as well.
Anna, we've seen through the study, that research that you presented, that there have been changes in student mental health. And can you tell us a little bit more about how that landscape has changed and what you see as some of those key factors driving that are?
Yeah, so I mentioned at the beginning some of the context that was present that caused us to want to update the study in the first place. And really what we were looking at is the post-COVID social isolation that the parents are acknowledging, that students are really struggling with maintaining friendships and relationships with peer groups, that they had healthy relationships prior to COVID and lost, a lot of that. So your students are reporting more social isolation, parents are reporting that too. And then the challenges of interacting with each other in schools is really, really increasing. So that's where we're seeing a lot of the students reporting, increases in bullying, parents noticing that too. A little bit of a difference in what parents saw versus what students self-report. But generally, it's the students acknowledging that they want to have more meaningful conversations. Especially, I will note too that students are asking for a mentor who is not an older person. They want a mentor who is just a little bit older than them. They want a mentor who's 5, maybe 10 years older than them. Somebody who they can see themselves becoming in their minds, in the distant future. But, for many of us, we think of that as, not too distant future. So that's really what they're asking for, are those connections and that sense of belonging and connectedness with someone.
Yeah. Ryan, in your day-to-day work as a school psychologist, what are you seeing?
I mean, I think the data is speaking for itself, and I love it because it's really painting a clear picture that's easier to understand. I'm seeing the same things as far as, you know, the mental health crisis is definitely a thing. You know, with some of the students we're working with that need higher level of support that the school can't offer, we're referring to some of these outside organizations or school-based therapists, and there's a significant wait time. So it's sometimes up to 3 weeks to a month of them being able to even get an intake to get some of those services. So with the students also reporting some of the lack of connections, I definitely see that here. I also think that the training that kind of goes into having those effective communications isn't happening at, you know, the basic education level for like teachers. So, you know, a part of a teacher's curriculum, which I'm not completely sure with, but when they're becoming a teacher and going through their program, I don't think mental health counseling is part of the instruction that they're receiving. So sometimes having those conversations with students can be scary and nerve wracking to, you know, but I think the students are identifying these teachers as someone they're trying to connect with because they spend a lot of time with them, sometimes more than with their family members.
Mm.
Hey, can you tell us like the role that families can play in fostering and supporting the mental health of young people?
Sure. I would like to start by saying that, you know, the most recent suicides that we've had, three very close together, Ashton, Clatterbuck being the last a couple weeks ago, pretty much all came from very loving, supportive communities and families. So and still, right, and still we have, you know, one of the leading activists in our town, Ashton, in a world designed to erase him, right? We have 479 anti-LGBT legislative bills nationwide. And so for families and friends, check in on the people that you don't think maybe need the help, right? Definitely check in. For folks that are afraid and activists or teenagers, just commit to hope, even if it seems like there's no hope, right? And also learn to rest and take time to access joy amidst, you know, really right now we're looking at, you know, a year and a half ago, 2 years ago, I think Ashton came to the LGBT coalition after having attempted suicide and being inpatient, right? So this is what I was telling people at the time, how dire it is, right? We are now looking at no longer people coming to me saying, hey, I feel suicidal. No, they're like, oh, I just did. And then they do, right? And so what I would say to people, community members and families, do everything you can to reroute systems of access to care, because that's exactly what's under attack, right? Most of the anti-LGBT legislative bills nationwide are directly attacking access to our trans and non-binary youth's healthcare, right? So what I would do and say to everyone, implore everyone to commit to a collective responsibility here because it is dire.
Ryan, how do school psychologists engage with students and support students who are grappling with and dealing with mental health issues?
Sure. I mean, you know, we have some training, like foundational training in clinical therapy. So, you know, I will work with students one-on-one while we're trying to connect them with maybe school-based counselors that can meet with them more consistently, teaching them some coping skills, and really just being that objective person to hear them out, to hear their concerns, to hear their voice, and, you know, being trained to respond to those effectively. I think some of the data that Anna was showing, you know, students just want to be heard. They don't want to be given advice, you know, so a lot of that time it's just a matter of listening to them and hearing them and acknowledging them, and then asking if they need help or asking if there's anything there. So that's a big role, especially in the high school student population. It's, you know, a lot of individual therapy services.
Yeah, Kay, you started talking about a little bit. Are there specific mental health challenges that are more prevalent among youth in the LGBTQ plus community?
Well, right. I think I mentioned, just the overall understanding that the majority of the systems in place, even in healthcare systems, I would say, certainly in politics and access to healthcare, there are people very openly, that locally discussing whether or not we have a right to exist. Right. So that is, and I would say that goes, for many targeted communities, but right now specifically LGBTQ plus youth and trans and non-binary youth are directly under attack. And so, yes, that does create a very difficult place to commit, like I said, to commit to a sense of hope, right? Or that there will be some relief. Yeah. But my biggest, message to most of the younger folks I work with is we have each other and we create places of connection and really looking at healing our relationship to trust, right? Because of the pandemic, I think all of us are traumatized and have to really look at ways that we can heal this connection and ability to trust.
Kim, can you follow up on that? I'm curious about how trust factors into the work that your organization does with youth and the wider community.
Was that addressed to me? Sorry.
Yes, please. Yeah.
Okay, yeah. So, I think trust is significant, right? So, and we're seeing this, with youth especially. So, and that connectedness that Anna talked about is so key. So you must build that trust. We need to, just we need to build relationships again. And I think what's happened, the pandemic did have far more lasting effects than we would realize. The disconnectedness post and during that time. I have to share that I think digital technology has had a huge impact on children's mental health. And I think, in the studies I've done actually for the past 5 years, there's a direct correlation to the rise in teen depression since the rise in media usage, digital technology usage. And the other thing is mental health is not just prevalent in the US, it's prevalent in every country. So it's risen in every country. So, but again, that disconnectedness. So, the digital technology disconnects us. And so I think that trust is very, very key. The relationships are key. Connectedness is key.
Yeah, you've raised an important point about technology and how people learn to use it and live with it. And are like, has anyone like have you seen any positive effects, or is it largely a negative story about technology and young people?
Lots of positive, right? So like I see our youth, and in fact, I just spent a week with some college students, and they talked about how much they learn online on their own, right? So I think technology is wonderful. Digital technology is wonderful for our young people. I think social media, though, I think with, again, that you can hide behind a screen and you can bully. You can, you present yourself in a certain way. So teen depression has doubled between 2011 and 2021. And 1 in 3 girls in the US has seriously considered suicide. So I think that our youth are less independent. We're seeing that fewer youth are getting, fewer 16-year-olds are getting their license. So they don't need that engagement because they're entertained at home. through social media. They're socializing in that way. They don't hang out socially, in person anymore. I'm saying anymore. It's not. And there's less resiliency in our children, in our youth. So I think all those things. We've seen declines in alcoholism, sex, and pregnancy among teens. But again, we've seen some great things, and we've seen some troubling data.
Yeah, Ryan, in your school, in your day-to-day school context, are there specific programs or approaches that you use or have seen others use in helping youth to engage with technology in constructive ways?
Yeah, I mean, I've just had this conversation with some students as well with the technology and social media, because my curiosity and just my general perception is that it feels like it's been a lot of negative effects. And they have reported some, but they also reporting that they are connecting with other individuals through social media and online that are experiencing some of the same things. They are on devices quite frequently throughout the school day. They are allowed to have their phones in school, which is just quick access to these type of outlets. And I think Kim was making a great point, and you have to think of the developmental perspective too, that adolescents from 12 to 17 are kind of going through these changes chemically in the brain. They're taking more risks, they're becoming more independent, and they're exploring more, but they're also listening less to adults. They want to do the experiences themselves, and they're comparing it with their peers. So I think that's also being magnified through the use of technology, is that they're seeing and they're comparing themselves to other individuals that they're seeing on social media, and it can have an impact on their overall mental health.
Yeah. Anna, how can youth be empowered to advocate for their mental health needs? That your survey and research started to share some of that story with us. I want to hear more.
Sure. So we have actually taken that data and turned it into an entirely new grants program with Touchstone Foundation. So this spring we launched a youth mentorship partnership program, and we're in the process of reviewing those requests for funding to really train our local organizations that provide out of school time care for young people. It's very exciting, so stay tuned for more. I'm hopeful that we'll be able to make some significant investments in our community. In addition to that, though, I think it's encouraging to hear the young people ask for really deeper, more meaningful conversations with each other. So a couple of years ago, we started hosting these Rise Above Youth Summits for high school students all throughout Lancaster County. And when we launched this program, we asked them, do you want a virtual platform? And they said no, like adamantly no. They wanted to meet in person and get together and really, build those relationships again. And so we bring in mental health professionals, and we do like self-advocacy 101, and learning the difference between therapy, psychology, counseling, psychiatry. Like these are things that they're asking to learn about, and it's really exciting. And they also love meeting other high school students from high schools outside of their own. So it's been a really encouraging and lovely thing to watch and see. And then we bring artists in to do some creative self-expression with the young people, so they have something to do, because again, like talking about mental health, like they said in the youth listening tour, what we heard was it's hard to just sit in a chair and open up to a stranger, to just sit there. To them, it's like they want to be active, they want to be moving around, they want to be doing something that they enjoy, an activity, a hobby, whatever that is, even if it's, playing games or video games or whatever it is that they enjoy, they want to do that activity with someone. And then, oh, by the way, I'm struggling, I want to have this conversation. So it's a little bit of a different, approach. And I think that is really empowering and encouraging to kind of meet our young people where they are and provide what they're asking for. It's not that hard, I don't think. I mean, it's outside of the scope of traditional therapy and counseling, but again, I think as adults, like this is our responsibility to show up for young people in our community.
Can I piggyback off Anna? Great points, Anna. Think about spontaneous play, right? And think about our kids have missed 3 significant developmental years through the pandemic. So think about spontaneity of play and that engagement and that comfort that's built through that spontaneous play. And so that, it's not hard, and our youth are asking for this, but these are things that we had as youth. Well, I'm a lot older than everyone else on the panel, but we could engage, with our peers and feel comfortable. The other thing, Joel, when you asked about advocating for yourself, I have a great story. So I just met a young man, 4th grader, who was seen as a significant behavior problem in school. He just so he would be pulled out of the classroom many times during the week. And our advocate stepped in, met with the mother. The mother reached out to our advocate here at MHA. And our advocate met with the young fella and the mother. And in that, she talked to him. They were able to identify that he was struggling with some significant mental health issues, a lot of anxiety and depression. And once they were able to identify that, our advocate worked with him to advocate for what he needed. And he showed up at an IEP meeting and he spoke. He advocated for himself. And now this kid, and you can meet him at our Noodles event on April 9th, but this amazing young man is just wrote his first book. And he wants to write 50 books by the age of 18. So I think, once we teach youth to advocate for themselves, to speak up. But again, we have to, as Kay said, we have to provide that safety. So we need to be working together as a community, even for our next generations, to ensure that we are providing safety for everyone.
Yeah, thanks. It's a really fascinating and important story. Yeah, Kay, I'm curious, can you tell us about how the LGBTQ plus coalition engages in empowering youth to advocate for what they need?
Well, we through the Touchstone Foundation, thanks to our Touchstone Fellow, we started our behavioral health clinic. So really encouraging all of the young folks to come, sliding scale or free, right? We also have our trans and non-binary group that's run by the fabulous Skylar Smith. And it's on Thursday nights. This is 18 and above, but we do have our youth group on Friday nights from 6 to 7:30. And we do as much as we can to reach out to the gay straight alliances, to reach out to come in and do in-services for kids in high schools. We're about to launch an affirming sex ed group. And, right now, again, just making sure we remind kids that we are here. We're here to help, and we're here to help connect. And then just also we have because kids were sheltering in unaffirming environments, we have a subsidized housing program. So we do have some spaces available, after getting 2 people to have Section 8 housing, which is incredible. That wasn't entirely us. I'll give a shout out to Rebecca from the Food Hub for that. But again, really, even if it is digital, even if it is, online therapy, I do online therapy myself. But this is why I am transitioning back out of my role here and going back into doing trauma therapy, just because it's much needed. So.
Thanks. Yeah, I see that we have a question that's come in our Q&A, and I'll take this quick moment to remind our audience that's joining us that if you have questions that you'd like to submit to the panel, to please do it through the Q&A feature, and we'll do our best to get to them. I think this question lines up well we'll start with Ryan for this question that came in. And the question is, what measures do schools take against bullying and harassment? And Julie, who offered the question, said, in my experience, bullying can worsen when addressed by administration, at least at times. Are resources provided for students and youth who are perpetrating these kinds of offenses, as well as caretakers and everybody that's involved?
Yeah, I mean, I think it's not a straightforward kind of topic when bullying comes in. There's a lot of complexity. So sometimes students are afraid to report that because it kind of does shine a spotlight on them, or they fear that the person that's bullying them may worsen it because they snitched, or commonality like that. But at least in the building I work with, administration and staff take bullying very seriously. So we take any reports, we run it through the chain of command, sort of, or the people that are best suited to have those conversations. There's been a lot of programs within the district too that do mediation groups. So even if there are some type of bullying between students, we can have an effective conversation between both of them to kind of fix the relationship. And I've seen that be very successful, and then maybe not be the best of friends down the line, but to coexist and share the same space. So it is taken very seriously, but it is a complex subject, and it's kind of required to be reported by the student, and that can always be a challenge as well.
Yeah, it clearly takes people from across the school community to address bullying. That it takes a concerted effort, and a related issue that we see with mental health is around stigma, around people being hesitant to identify as needing support and assistance. And so yeah, I'll open this up to the group and not direct anyone in particular, but how can students and teachers and organizations and families work together to reduce stigma associated with mental health, and things that we can do to support, provide the support that's needed?
I've seen a significant shift. There was ever a time that we had a reduction in stigma, it was during the pandemic, right? So, and I think that's been, and schools are now addressing mental health. We're talking about mental health everywhere. But the education is still important. And we need to be, and it needs to come from families, it needs to come from our faith communities, it needs to come from every sector. And so being comfortable with the conversation, opening up, and just, we can all work together to reduce the stigma. Again, I've seen a significant reduction. I just met with the former ED of Mental Health America, and she said that they had stigma as a barrier, and we are not seeing it as much in our youth. Anna, and you can speak to this too, and Ryan and Kay. Yeah,
I would absolutely agree. We're seeing our young people be much more open and actually seeking to have these conversations about their mental health. The barriers are more among parents and caregivers, and I think some of that comes from, the high cost of therapy and counseling, and some reluctance around, trying to schedule appointments, and co-pays and deductibles being very expensive. So we have the Mental Health Access Assistance Program. MHA has their community CMAP program for 3 free visits, and we work together to try and alleviate that cost as a barrier. But our young people are very, very open. In fact, they want much more deep. They don't want surface level conversations. They want longer term, deeper, more meaningful discussions. They want to go right into, you know, some really hard topics. And so I think, again, like our responsibility as adults is to foster that and support it with a lot of empathy and you know, providing the guardrails and the support that our young people are looking for, to have those conversations, to help them build empathy, to build that trust, and to just listen. Like I think Ryan and Kay both said, like just listening to our young people is really mostly what they're asking for. If we shut down the conversation, then that is just, you know, going to send a really strong signal that like we're not comfortable, and that's going to reflect in that, like, you know, stigmatizing the conversation further. So I think just, you know, being open and listening.
Yeah,
Yeah,
go ahead.
Go ahead.
I was just going to say, I totally agree. I think that the majority of my time as a therapist was often spent with the guardians and the adults. Kids, you know, in terms of their identities and who they are pretty good with who they are, right? And there is a sort of a normalizing acceptance and celebration of, you know, sort of a gender revolution among younger folks. And so I would also just kind of remind, you know, people that, you know, I think the folks that we need to help build empathy with, or help the ones that are actually organizable, are the people that are kind of in charge of some of the systems in place, to help develop empathy on a sort of larger sort of adult people in power, positions of power scale. And then also just to remind folks, we have a parent and guardian support group tonight, 6 to 7:30. So that's once a month. And I'll send information out about all this.
Yeah, and I just wanted to piggyback what everyone was saying and kind of highlight some of the main points. Is education across wide. You know, I think mental health awareness has become a lot more mainstream for this generation. So that's why I feel like the students are much more confident in expressing themselves and their needs. There's still, I think, that generational gap of, you know, even a decade ago where mental health was still very stigmatized, wasn't talked about much, and you know it's just kind of ingrained themselves as they go on to have those conversations. It's still scary among parents and older staff members. So I think just educating individuals on how to have those conversations. First, you know, not being afraid to have them. Also being very much aware that this person is coming to you, and so you should be grateful that they're opening up. And also knowing what resources you have. Like I understand, you know, you might not be the most qualified to have those conversations, and it might be above your head, and to refer them to someone more qualified. But it's still important to build that relationship there, to have that conversation, acknowledge that person, not just feel like you're just another person being passed off to some other professional or a stranger in their eyes. So definitely educating, you know, all generations. And I'd be intrigued to see what the data says moving forward with, you know, as generations move on, how does mental health get impacted in that sense in the services and data. So I'm intrigued.
Yeah.
Another fascinating questions come in from Jim in the Q&A, and Jim writes, as a faith community leader, how might a faith community engage in creating safe spaces for these conversations? I'm thinking of how to equip laypersons to facilitate the type of conversations youth are seeking. How might a faith community connect with teaching resources and create those safe conversations?
So MHA hosted a two-part breakfast last spring, and it was to engage the faith community on mental health, to provide them with resources in their community, and to encourage them to help reduce the stigma within their communities, but also to provide education within their communities. They have the audience, they have the trust. And what we found is 11 churches actually have started a mental health, like they call it a care group or mental health missions team. And I attended one of them, and it was a 6-part educational session educating a team of 10 members of that faith community on stigma, on how to address mental health, how to connect people, really showing them what mental health, it's like what mental health, different mental health diagnoses look like. So it was providing education and next steps. So, and we educated about 100 attendees, and I say it's two-part because we did the faith leaders first, right? Because we wanted them to get on board. We wanted them, it comes from the top, right? And then we asked them to identify champions within their faith communities, to, move this work forward, to provide education within their faith communities, help reduce the stigma, and build care teams.
I can just add on to that a little bit that there is a really great foundational training called Mental Health First Aid. And I would encourage, everyone, I know the schools and many folks in our community have participated in it. It's an 8-hour training. Community Services Group and WellSpan Philhaven both have trainers, in our community. Mental Health First Aid is like CPR for mental health. And it's a great entry into building that knowledge and that confidence so that when someone comes to you, like Ryan said, you're less likely to, shut the conversation down and more likely to respond with empathy. There's also a training for adults called Youth Mental Health First Aid that focuses on obviously our students. And then there's a teen version. So if teenagers, in their schools want to educate themselves and become, the best advocates that they can be, they can do the teen mental health first aid training.
Great point.
I would also love to just hop in, obviously, that I'm sure that the folks on this call are some of the good ones, but I would say that, really openly discussing in congregations, in your faith spaces, that, religious freedom does not mean a veil for hate. It is not, we cannot have it be a veil for hate, right? This is a lot of the, sort of policy, and some of the people that are protesting the most come from, quote unquote Christian values, national Christian values, right? And we are looking at the faith leaders. I believe it is your responsibility to step up and to really make this an open conversation, and to be able to sort of call out or call in to help the people that are, calling themselves Christians, and making sure that you can provide a truly safe and loving space. And we would be happy to come help if you have any questions with that.
Another question from the audience has come in from Maniqua, and she asks, what services are available to those non-English speaking communities? And are we providing this valuable information in alternate languages in our diverse communities? And maybe I'll point that at Ryan first.
Yeah, I mean, that's a great question. In our community, there's a very diverse population, and me specifically working with Haitian populations. There's been a lot of barriers as far as getting them connected with services and mentors and advocates to even help translate meetings. So I think that is something that I think the community could definitely improve on, and connecting them with those services, but just making it very much easier and understandable, and also kind of helping differentiate the cultural impact of maybe mental health from wherever they're coming from, to realizing that it is a very much a real thing, and it's a need that their student needs. So I think that's something we can improve on. And I don't have the correct answers, I'm sure, to help, but that's a great question.
I can just build on that a little bit. We hosted a Rise Above Youth Summit last summer with Church World Service for their youth, for their young people. And we brought in Communications Essentials to do live translation. It was amazing. It was really, really wonderful. And it was very, culturally sensitive and appropriate for that group. So I think the more that we can do to engage and collaborate in our community, the better for all of these young people. There are there are resources, and Kay mentioned our mental health clinical fellowships. We are actively trying to recruit and retain more students who want to become licensed mental health professionals to build that community of practice so that we have folks in the mental health workforce who are representative of our community that we need to serve and need to serve them, you know, appropriately in their preferences, whether that's language, culture, gender identity, all of those things. So we're working on it, but it unfortunately is not a quick fix.
Yeah, and I would also say, you know, including, you know, the, you know, lack of access to ASL interpreters. I had a situation quickly, I know we have to end, where I had a client who had to wait 5 years to see someone who knew anything about trans issues. And then when I had to pay for the ASL interpreter. So I ended up, the first person who was going to be sent to us was also not affirming. So then we had to reroute that. And finding ways for us to combat sort of making sure that we're not discluding, you know, disability justice along with our advocacy. And I also, you know, want to kind of just point out, you know, the obvious that this, I'm going to make an assumption, we're mostly a white panel, right? And so like this, again, coming from a culturally humble standpoint, but, you know, that the next conversation really would be great if we could expand it into just this, right? Now, where are the areas of advocacy that need to happen? And I think Touchstone is doing a great job with this, with the pipeline for, you know, targeted communities, trans, non-binary, BIPOC folks. Like, it is extremely expensive. There should be a residency, and there's not. So they've created a program where the fellows come and they get free supervision. They fund the supervisor somewhat. And then this is, again, a commitment to staying with this, you know, young students that are coming out of a master's program. These poor babies, I'm telling you, like, it is not, they just spit you out. And so, like, yes, to be able to access this very cost prohibitive supervision is a really great gift. So thank you.
Yeah, I know that. Yeah, like I feel like we're just touching the tip of the iceberg about, you know, about ways that we can proceed together as a community and helping to support everybody and you know, young people and everyone who are grappling with mental health issues of different kinds. And that, you know, that our hope with the conversation is that we're, you know, that we're sparking further conversation, but then also want to provide ways for people to get involved. And so I want to throw out one last follow-up tiny question to the panel about like what's one thing that people can do to get involved in this right now?
Okay, so I think talking to your legislators to bring more dollars to Lancaster County for mental health services. So we talked, several of us talked about connecting, you know, young folks and others to services. We don't have the funds in Lancaster County to build out those more intensive services. We're all doing a really good job of looking upstream to on early intervention and prevention work. But, you know, in education, and we need to continue that, but we need more services to treat youth that are really struggling.
Yes, and I would also piggyback off of that we really encourage everyone, just get involved. If they need some help with advocacy, we would certainly be able to help, but really, you know, addressing the fact that the people in charge of funding are not organizable, and many folks, some of the folks that are in charge of, you know, funding in this area are absolutely openly discussing our, you know, not basically that we don't belong in all spaces as the LGBT community. So I think that looking at diversifying the way that we get funding here, and you know, making sure we elect officials in our county that are truly for all the people.
I think not, you know, trying to reiterate the same information, because I do think those are very valuable. I definitely agree. Legislation and more providers are some of the top important things. I think just from a school perspective, encouraging students and parents to share the stories and the struggles that their students may be facing. I know sometimes the schools don't have the best reputation, but there are individuals there that care, that are trained to help, and mental health in the schools have increased dramatically over time. So there are resources, there are people there that can help. We just need to hear your stories. You know, confidentiality, building trust, all that is valued here. So just promoting them to reach out so we can help.
Yeah, I don't want to replicate what I agree with that everyone has said. And I'll just add that I think connecting with each other in meaningful conversations is really important, and taking the time to really listen, especially to young people when they are in a vulnerable space, opening up to us as adults, to take the time and really listen to them. Also encouraging young people to pursue their passions, their hobbies, their interests, helping them get connected to whatever that is that's healthy and safe in out of school time, can help to forge some of those relationships for them with healthy adults in their lives. So whether that's a support group or a fun activity or hobby, something like that, I think is just really, really necessary, and that's some of what we had lost during the pandemic that is available and coming back now.
Yeah. Kim, can you remind folks when there's two different suicide survivors of suicide support groups for MHA?
Yes, thank you. Thank you, Kay. They run on Monday evenings. So we have alternating weeks. We have Families and Friends of Suicide and the Teen Suicide Support Group.
Yeah, thank you.
Thank you, Kay.
Yeah,
Monday evenings.
thanks for sharing that. Yeah, thanks. Yeah, and yeah, we reached the end of our time. It went very quickly. The conversation was fantastic and very important. I want to thank all the panelists for joining us today. Please visit Touchstone Foundation, Mental Health America of Lancaster County, and the Lancaster LGBTQ+ Coalition. Visit their websites, reach out, contact. Thank you to the School District of Lancaster too, and Ryan for your participation. I want to say a thank you to Kyle Gamble from the United Way communications team, who has made all these things work very well today. Thank you, Kyle, and to our marketing communications team. For the audience, thank you for your questions and participation. We weren't able to get to all the questions, but they're totally fantastic. Please watch for the follow-up email that'll be coming in a couple of days, and we'll include links to resources that were mentioned in our conversation. We encourage you to visit United Way of Lancaster County on the web, and to follow us on Facebook and YouTube and on Threads. And please find out about upcoming events, and we look forward to your involvement in the community. Thank you, and we'll look forward to seeing you soon.
Thank you. Thank you.
Thanks, everyone.
Bye, everyone.